I'm Dr. Sarah McNulty. I'm the Director of Public Health for Knowsley. I work at Knowsley Council. Hello and welcome to this special podcast brought to you by the 3 primary care networks in Knowsley, West Knowsley, South and Central and Kirkby. So today we're coming together to talk about something really important and really timely, and that's childhood vaccinations. And that's in the light of a recent measles outbreak here in Knowsley, and we want to share trusted information, dispel some myths and offer support to families who may have questions or concerns. So joining me today, and I'll let them introduce themselves, are Gary. Would you like to introduce them?
Thank you, Sir. Yeah, my name's Gary C, and I'm a Director of Explore Partnership CIC. We're based in Knowsley. We've been doing some work around children's health and well-being, including their families.
Gaynor.
Hi everyone, I'm Gaynor Chisnall and I am the immunisation lead and team manager for 2 immunisation services. One covers Knowsley and one covers St Helens, and I work for Mersey Care.
Okay.
I'm Kate, I'm a Knowsley patient and a new mum. And this is Isabella.
Okay, so just to set a bit of the scene, so I've just mentioned that we've seen a recent rise in cases of measles here in Knowsley. So people may remember that last year we saw a few rather large outbreaks in other parts of the country, like London and Birmingham. And again, this year we've started to see cases rise again across the country, but this time we're also seeing quite a number of cases in the northwest, and we have seen a pretty significant number of cases in Knowsley and an outbreak in a school. And so it's really, really timely, this, because we know that we can help prevent the spread of measles if we have people in the population who have been immunised against measles and who've got vaccination. So I'm just going to talk to Gaynor first, just about measles.
So measles is a really highly infectious disease, and if one person contracts measles, they can infect up to 15 unvaccinated people. It is passed through droplets, so coughs and sneezes. Even if you go along and then touch a surface where someone's coughed and sneezed and touch your nose and mouth, you can then go on to develop measles. There are quite serious complications to measles. Lots of people think it's quite a mild illness. It very often isn't, and can cause some catastrophic outcomes for all age groups. So everybody is susceptible from measles if you haven't had 2 doses of measles, and there isn't any upper age limit to having your measles vaccine.
Yeah, I think that's really important to say, isn't it? That, you know, it isn't a mild disease in anyone. And I think particularly there are groups in the population where it can be really serious. So people who don't have a fully functioning immune system in particular. And unfortunately in them the vaccine doesn't sometimes work. So it's another reason.
We can't give it, can we?
Yeah,
so anybody with a really low immune system, we can't give the vaccine, because the MMR is one of our live vaccines that we give to children and adults, and that's why we look for at that 95% coverage across our communities. So that's what we call herd immunity, and herd immunity stops that infection to get into those really vulnerable children and adults.
So MMR really important for everyone, and especially to protect those people who it won't protect as well.
Yeah, so I think it's important to say, so the MMR vaccine, we offer that when your child reaches the age of 1, and then when they just prior to them going to school at 3 years and 4 months currently. Babies, as we've got our beautiful little Isabella with us today, she'll be protected from her maternal antibodies. So as long as women pre-pregnancy have got 2 documented doses of measles vaccine, through pregnancy and through maternal antibodies passively transferred to that baby as they're born, that generally lasts until the baby's about 9 to 12 months old, and then they go on to have the routine vaccine at age 1.
So we're saying that both doses of the vaccine are important.
Absolutely,
as well.
both doses. So your first dose you get at age 1, then your second dose at 3 years and 4 months currently, that is due to change, and we're going to bring that forward to when little ones are 18 months old to get the second dose, but they absolutely need 2 doses. Not everybody produces enough antibodies from the first vaccine, so that's why we give that second dose. It's not a booster dose, it's a second dose, and that then gives you protection.
And it's not the only vaccine that we give to children, is it?
Absolutely not. We've got a multitude of vaccines that we give to children, and every single one of them are important. And again, we've seen a decline in our measles uptake, our MMR vaccine uptake, but we've also seen a decline in all of our routine childhood immunisations. So they start at 8 weeks old, and then we give vaccinations. So little one will get a 6-in-1. They'll get a pneumonia-containing vaccine, they'll get a meningitis B vaccine, and they also get an oral vaccine that protects against rotavirus, which is diarrhoea and vomiting. And we get those at 8, 12 and 16 weeks old. Then they'll be invited at 1 year old, where they'll have their first measles, mumps and rubella vaccine. They'll have the meningitis B booster vaccine. They'll have another pneumonia-containing vaccine. And currently we are still offering Hib-Menc, but that's going to be a change to the programme. Flu vaccine, again, we're coming up, although we're still in summertime, we're coming up to flu season very soon. I know my teams we're busy planning our flu vaccine, so children from the age of 2 are eligible to receive a flu vaccine. That's a nasal vaccine for the majority of our population. We do offer a porcine-free injectable vaccine, and we deliver that in school, but again, across the population we offer flu vaccination. Then we go on to our school age vaccination, so when children are in secondary school, we give girls and boys now HPV vaccination, so that protects against human papillomavirus. That was first introduced back in 2008. We offered that to girls, and that was to protect girls against cervical cancer. But what we are seeing now, and we introduced it to include boys from 2019, and that protects against head and neck cancers, cervical cancers, anal cancers, penile cancers. Our boys' uptake is nowhere near our girls. It's about 10% lower. So yeah, come on boys, get your HPV vaccine, you absolutely need it.
Yeah, you know, all of those vaccines, like you say, are so valuable, so important. And things like, you know, the HPV vaccine in women potentially could eliminate cervical cancer in the future.
And we're seeing that now, aren't we, with you know, cervical smears that women are having. You know, the decrease in cervical cancer is huge.
Yeah, it's amazing.
Huge.
It's amazing. So one of the problems that we have in Knowsley, and one of the reasons why we've seen this rise and these cases, is that, as we've said, we don't have enough people in the community, and young children and young adults in the community that are immune. So the disease is able to spread. We haven't got those blockers, those people that are immune. And actually, we know that around 15% of 2 to 4 year olds are unimmunised, so are not protected against MMR. About 9% of our 5 to 11 year olds are unvaccinated, and we see even worse uptake in our 20 to 30 year olds. And we think some of that is because at the turn of the century there was an MMR, a lot of misinformation about MMR, and a lot of misinformation about links to autism and things like that, which were disproved. But we can see the impact of that misinformation that was around at that time, and this unvaccinated people. So that's why we're really concerned that we're seeing measles cases rise. So I guess, Gary, I'll come to you now. Any ideas of what factors might be contributing to lower uptakes locally? I know you've done a lot of work with the community.
We have. I think it's important, just taking on board some of the discussion so far, is to understand how people may feel or why they feel against vaccination. So I always refer to them as anti-vaxxers, and that's not to be negative, but we have to listen to why they feel so strongly against vaccination, so we can understand what can we do to try and alleviate that concern that they've got, what can we do to give them the trusted sources of information. So us sitting here today, for me, is an important part of trying to break down those myths and dispel some of that misinformation. And from the insight gathering that we've done with children and adults, one of the key messages is about this constant need for example, NHS messages that are pushed out that are perceived to be a pushy message rather than a supportive message to children and families. And that's why we've started again in Knowsley to deliver a different set of messages to adults or parents or carers of children around not a pushy message, but a message that is supportive, to understand, to give real context to why vaccination is important around immunity, but also to understand we have to listen to those people that are anti-vaxxers and don't dismiss them, but actually also try and give them the correct information, because they are the people who are sharing those messages on platforms that we would never get the opportunity to do. And again, understanding that children, whilst if we look at MMR, especially at such a young age like a baby, don't get a choice in those immunisations, and it is a parent's choice, that there is still an option as a child becomes older to learn more about their health and well-being. And actually as they become older, they are the next generation of potential pro-vaccinators, and also the potential to be anti-vaxxers if we don't give them the right information from an early age.
So do you want to tell us about what you've been doing?
Yeah, so we developed a resource which is called the Hero Training Academy, which is about children and young people learning everything about their health and well-being, from hand washing, around hygiene, around, you know, the 5 fruit and veg a day, but also having a very subtle link to vaccination, because again, we don't want to have that pushy message about vaccination, but they do touch on that subject. And it's been interesting to see those children have such a clear understanding of what vaccination is and how immunity can happen if there is vaccination within that community. And then because of that, with that link to parents and carers and children being able to take resources home, we've been able to develop some resources to support children to take a clear message home to parents and carers, which again is not to push anyone in a particular direction, but to give them the opportunity to trusted sources of information so that they can go and find that information if they so wish, but also to have someone like Gaynor or a member of Gaynor's team who can listen to those conversations at an opportunity which may be in a school setting, which is a safe environment, not a health setting, where people may feel safer to have those conversations. So the work we've done has just been about giving those clear messages, the opportunities for an opportunity for a conversation with a health professional, and sometimes not a health professional because that might be off-putting to people, but they know where to get trusted sources of information, and not necessarily through some of those sources of information where we would all go to, which may include Facebook, social media, where our message never cuts through about why we would like people to understand the message of why vaccination is important. But that's not a message of you must get a vaccination either.
It's being informed, isn't it? And I guess it's looking at vaccination in the round of other things that you do for your health. You know, you mentioned there about kind of eating healthily, brushing your teeth, you know, all of these things are things that we know benefit health. So why don't we have the conversation about vaccination as well?
100%.
In that round.
And I know as a parent myself, and haven't recently become a parent again of a young baby, the importance of vaccination's never been a question for me, but I know so many people around me have asked me, am I getting my child vaccinated? And it's a personal choice that we have to respect, whether people do or don't. But I feel confident to say my choice is based on trusted sources of information, not on what people like to have as hearsay, or you know what they might have read or misinterpreted somewhere else. For me, it's important that parents and carers, in particular of babies and young children, have those opportunities to gain trusted source of information, and from that can make a choice about what they so wish to do. Because if we want to aim for the 95% in terms of herd immunity, that 5% might not always include children or adults who might have a health condition. It might just be those that don't wish to be vaccinated, and we have to respect that. But more importantly, if we can aim to get to the 95% because people have got trusted information, for me, that would be an amazing place to be, based on people feeling they've got the right information.
So it's striking that balance, isn't it, between kind of having the correct information but also kind of respecting people's concerns. Probably feels like a good time to talk to Kate at this point, doesn't it?
Yeah, I've been wanting to get involved in Gary's conversation a lot because I felt as a new mum, when it came to the topic of vaccinations, there was a lot of negative information out there, and as you say, in terms of social media, the things that are going on, and I found that positive information wasn't really readily available. So with regards to vaccinating Isabella, it came down to a personal choice. I'm also a school teacher, and I can see how quickly childhood illnesses can spread within the classroom, and I can see how quickly germs are passed from one child to another. So as a parent, I felt to get Isabella vaccinated would be the best decision, because it'd take away my anxiety as a parent and it'd take away that risk, and it's all about eliminating risks. But I do wish there was more information out there, so just hearing Gary talk about his project seems like a really positive step in the right direction. And Isabella seems really excited about it too.
And did you see some of the negative information then?
Oh, definitely. Even this morning I was searching on social media platforms about the vaccines, and instantly it's negative things that come up. It's just like TripAdvisor. If you're going to go on holiday, you only make negative reviews. You never go and say, oh, how wonderful it was. And I feel people are too quick to comment on the negatives, but there's not enough positive out there. And when you do speak to health professionals, you refer to online sources and more academic sources of information, whereas I feel projects and conversations within the community might be more beneficial. I feel you get that level of trust a little bit more in having that conversation, and more often than not, the people that you would be talking to are parents too.
Yeah, I was going to say, do you talk to other parents about your experiences?
Definitely.
And views? Yeah.
And I feel like as a new mum, quite often you do refer back to generations before. So I spoke to my mum, older family members, and again, they've been involved in, as you say, the MMR, what's the word
Scare,
for it?
probably.
The scare for it years back, and there's a lot of talk and negativity around it. So again, sometimes people's views are hindered by negative perspectives and like opinions of the time. So I wanted independent view, really.
So Gaynor, what sorts of things what are the myths out there around the vaccine?
So the big one where MMR is concerned is obviously autism, isn't it? And that it causes issues with bowel problems as well. Every single one of those, the myths have been looked into, researched. The doctor who did that has been discredited, is no longer recognised as being a doctor. But it is those historic conversations that will always crop up. And I have been delivering immunisations for 20 years now. When I first joined the team, we had the luxury of time where for families and parents that were anxious about getting the MMR vaccine, we could go out and visit those families and have conversations with them, just to, exactly what you were talking about, Gary, just to have those conversations. What is it? What are you concerned? What can we do to help? And this was a mum whose one of her family members had the MMR and was diagnosed with autism, and the whole family were just convinced that's where the autism came from, and there was nothing I could say. And I visited that lady 3 times, and then out of the blue, about 9 months later, I got a phone call from her to ask me to come out and do her child's, and I've even got goosebumps now. Every time I tell this story I get goosebumps. Would have come out and do her little boy's, he's probably about 21 now, do his MMR vaccine, and he had been almost close to death with mumps in Alder Hay, and the consultant said to her, as soon as he's well and he's home, have the MMR vaccine. So that's just one story that does, and as I say, I've told that story many times, and it still makes me goosebump. And I think that's some of the thing where we've talked about many times. Vaccination is preventative health. You don't see the benefits to it, and you never really see the preventative bit of it because we're protecting you. So you never really see what could have been because you're vaccinated. It's just when we've had, the really sad story in Alder Hay a couple of weeks ago. That's the reality of not vaccinating your children.
And I think, like you say, because historically vaccination has been so successful, actually we don't see these diseases
absolutely not.
Usually like we do, like we did. So you don't realise.
We absolutely did. Even chatting downstairs earlier, we were talking about even polio. Some of us remember that, some of us absolutely don't. Diphtheria, they're like, what is diphtheria? But if our vaccination rates continue to drop the way they are, we're absolutely going to see those. We really will. And going back, we rely on consent. So everything, as Gary says, we're relying on parental consent. So for our babies, Isabella's age, our 0 to 5 year old vaccination programme, that relies on parent receiving that invitation to go along to the GP, and it's parental choice. Our school age immunisations, we send out consent links, and that goes to the parents, carers, and we wait for that consent to come back. We do lots of active follow-up of non-responders, but what we do, kids, if there's any of you out there listening to this, have those conversations with your parents. If your parents have declined and said, we would rather you not have that conversation, you yourself have a look for that information out there and speak to your parents. There is something that we can do where we Fraser competent or Gillett competent, where we can have a conversation with a child in school and vaccinate that child. We can do that. We would rather it be a family decision, have a chat with your parents and the parents come to the same conclusion. But again, once you're 16, you can consent for your own vaccinations.
And I guess that's a key message, the MMR vaccine isn't just available until you're 3.5, is it? It's,
absolutely not.
If you haven't had your 2 doses, there you can still get covered.
There is no upper age limit.
And we are seeing measles cases in adults as well, and it's still an unpleasant disease if you get it when you're an adult. One of the myths that I'm aware of is that myth that natural immunity is better than vaccination. So if you have measles, somehow that gives you a better immunity than not, and we know that's not true, and we know that actually viruses like measles can actually affect your immune system. So you're much more susceptible to pneumonia and things like that, and secondary pneumonias as a result of having measles.
And the course of natural infection is unpredictable. We can predict, following a measles, mumps and rubella vaccine, little one might get a rash 10 to 12 days afterwards. They may get some swollen glands from the mumps component, 3 weeks, but it's self-limiting, and it doesn't go on to cause these horrible complications.
I was really surprised to see that on the NHS app you can actually go back and see all the vaccinations you've had as an individual. So I could go back to my childhood vaccinations and see what I've actually had or if I've missed any. So that was really surprising. Yeah,
it's difficult to remember something that happened when you're 3.5.
Definitely.
So yeah, it's really, really valuable. You can check and see whether you need to have a dose or 2 doses as well. Anything else, Kate, that you want to say to anyone out there or other parents, or anything about your experience of the vaccine?
I think a lot of the concerns around the vaccines as well are to do with a child's development, and I think one of the things that we quite often neglect is the fact that when the children are having these vaccinations, they're quite often at key developmental stages in a child's life anyway. So Isabella had her vaccinations around 4 months, which was also in line with her 4-month sleep regression. So there was a lot of unsettling moments within Isabella's life at that time. And some people might put it right down to the vaccination, but there's a lot going on. A child's continuously developing. So she just develops at her own little rate, and we keep you as safe as possible, don't we?
And how was Isabella after her vaccinations?
She wasn't too bad, to be honest. So we gave her Calpol after the first ones, as suggested. We were a little bit worried about the oral one because they said that we had to watch her nappies, make sure that we were washing our hands and make sure it didn't spread throughout our household. But other than that, she was great. We had 2 days maybe of her being a little bit unsettled, but we're always looking for mummy cuddles, so
Absolutely.
It was great to have extra cuddles.
So there's a lot going on in Knowsley. I guess it's probably worth highlighting because we've seen this rise in cases. And, you know, there was an outbreak and, you know, that outbreak was managed. But we are seeing cases increase and we are seeing cases pop up in other places. And we're seeing cases across kind of Liverpool and Sefton and other parts of Cheshire and Merseyside, just like in other parts. So there is a big drive to offer the MMR vaccination to anyone that needs it across Knowsley. Do you want to talk a little bit about what's on offer there?
So yeah, and just to expand on what Sarah was just saying, then travel, so summer holidays, we're just embarking on the summer holidays, so foreign travel, so you know, people from all over the country are going to be all getting on planes, all going sunning themselves, and that's, you know, planes are a confined area where infections can spread, but definitely within Knowsley we have got many clinics. We're putting on additional clinics for families who are concerned, you know, worried that they've not had 2 doses of MMR, that they can come to. So within the Knowsley immunisation team we have got 10 clinics across the whole of Knowsley. We put an additional 3 on last week, but we've got 10 throughout the summer, and they will cover every part of Knowsley. So we'll be in Huyton, we'll be in Halewood, we'll be in Wiston, we'll be in Prescott, we'll be in Kirkby. Also, you can have a look on the Knowsley
News
website, because CWP, the Living Well bus, again, they're travelling around lots of different sites, not only just in Knowsley but across Merseyside really, and they're offering MMR vaccinations also. So as I said earlier on, I work for Mersey Care, and within Mersey Care we've got 4 immunisation teams. So we've got a team in Liverpool, we've got one in Sefton, we've obviously got one in Knowsley, and we have one in St Helens, and you are welcome to access any of those clinics. Probably between the 4 teams, we've probably got 50 clinics going on all across the summer. The Liverpool team do offer Saturday clinics as well. So, you know, you can get in touch with us at any point.
Yeah, and I'd say also you can contact your GP for vaccination too.
Yes.
No, it's okay.
Absolutely. So GP and practice nurses, I always feel sorry for our GP practices. They're inundated. But yeah, GP was probably your first point of call. To, you know, check your vaccination histories, but obviously you can also contact ourselves as well.
Yeah. And I'd say keep your eye on that Knowsley News website as well, because there is additional clinics that are being put on as well. Isabella wants to say something as well, doesn't she?
I feel like it's really important what you said about going on a holiday too, because I was only speaking to a friend the other day, and after the outbreak being all over the newspapers, they were very concerned about their child being unvaccinated. And we're going on holiday very soon ourselves, and myself and my partner were only talking last night saying how much more chilled we'll feel about travelling, knowing that Isabella is completely vaccinated. Sitting on that aeroplane could just be a high for him. And that's okay, isn't it?
So I'm just thinking about wrapping this up, and thinking about, you know, if someone's watching or listening and they're unsure if their child is up to date, so what would they do? So we've said about checking the NHS app, contact your GP as well, they'll know too.
Your red book, you know, you should take your red book. All children have a red book, and take that to all your immunisation appointments, and they'll write all your vaccinations in that, so you can check on that.
And I guess something that, you know, I'd like to ask. So what's one myth that each of us would like to bust once and for all about MMR? Carry on, start with you.
I think it's not necessarily a myth about MMR, so forgive me. I think it's more dispelling the fact that health professionals don't listen, and they do listen. I just think, as Gaynor said earlier, they're pushed for time and don't always have that opportunity for a meaningful conversation. But if anything, what I've seen in the past few weeks is that opportunity for that conversation has been opened more so now, so that parents, you know, adults themselves, if they're unclear if they've been vaccinated, can have a conversation. It's not about going in and speaking to an health professional thinking I'm going in and someone's going to see me straight away and go, right, they're getting vaccinated. It's an opportunity to have a conversation in a safe space, so that you're away from social media, you're away from the constant negativity that is being absolutely pumped out now. And I understand how that can concern parents, as a parent myself, but go and speak to the professionals, go and speak to them and have a conversation about what this actually means, and you can then make that choice and that decision based on someone telling you the absolute truth of what this vaccination can support. And also some of the things, as Gaynor has alluded to, you know, some of the things that, again, a fact that you need to walk away and go, actually, I know now. So my child who gets vaccinated for within, you know, 10 or 12 days may have a slight rash, may, if it is a baby, might have a little bit of sleep regression. These are natural things to happen and are expected. But if people are scared to go and have a conversation, to just start off, I think that's a bad place to come from. For me, it's not about MMR necessarily. It is about just go and have that trusted conversation. And if you still walk away and it is not for you, that's fine. No one will feel bad about you. But it's also about knowing when your child's old enough, they've got an opportunity themselves to have been given information that they can then make a decision for themselves.
Okay.
I think I wouldn't tar every vaccination with the same book or the same brush, because I feel like at the moment a lot of people are referring to newer vaccinations and thinking, oh, there's not enough research out there behind them, so I'm just not going to get my child vaccinated at all. Whereas a lot of the vaccinations that children are given have been given for many years, and there is a lot of research behind it. So when it came to vaccinating Isabella, I said, are these new vaccinations? And I was reassured that no, these are vaccinations that have been given for a very long time. And that gave me a little bit more reassurance. But don't just turn your nose up at a vaccination. Go out there, ask those questions and find out a little bit more, because as a parent, you've got every right to do that for your child, and she'll soon be asking those questions herself.
Gaynor?
I mean, I suppose for me it's the autism myth that MMR absolutely does not cause autism. And I just think, you know, that was way back in 1988. That's a lifetime ago. And we know there have been many studies where they've withdrawn giving MMRs, and autism doesn't change. It is absolutely out there. The MMR vaccine does not cause autism. But when Kate was just speaking then, and I think it is just to put it out there and to reassure people that once we introduce a vaccine programme, we don't just introduce it and leave it. We're constantly watching how that disease, you know, the epidemiology of all the disease and how that all changes with the introduction of vaccine programmes. So it's like meningitis C vaccine, one that was introduced in 1999. We continually watch what happens with those diseases and how effective that vaccine programme is. So now we're going to be down to, this time next year, we'll have one meningitis C containing vaccine within our programme. HPV vaccine, which I've already talked about. When that was first introduced, that was a 3-dose programme. Then it went to a 2-dose programme. And now we know through the constant research and the constant evaluation of them vaccine programmes that 1 dose gives us adequate protection, really well protected. So it is just to reassure people that, you know, once we have a vaccine, we don't just leave it and go, right, well, that's there. We continually monitor it. And the one group of people who I feel like I have forgotten, and Isabella's there, is our pregnant women. So our pregnant women are offered vaccinations all throughout the pregnancy. If they're pregnant through flu season, please get a flu vaccination. We protect our pregnant women against whooping cough vaccine, and that will go on to protect your newborn up until they can have that first vaccine at 8 weeks. Back in 2012, we lost a number of babies to whooping cough before they were 8 weeks old, before they were old enough to get those vaccinations. We now protect pregnant women against RSV. One of the things that RSV causes is bronchiolitis again. That sends shivers down my spine. My baby was desperately ill at 4 weeks old with bronchiolitis. She's absolutely fine now. But, you know, had that vaccine been around then, we wouldn't have had to gone through that heartbreak at that time. And ultimately, that's what we're preventing, those absolutely catastrophic, devastating incidences that are real and do happen.
I think that would be my myth bust or key message would be, you know, these diseases have been around as long as human beings have been around, and they have been causing great amounts of disease and death since human beings are around, and vaccination is actually an absolutely wonderful thing and has saved lives and continues to save lives and has saved a lot of illness. You know, we mentioned about HPV, it's a relatively new programme, but actually we're already seeing it could practically eliminate cervical cancer, which just is phenomenal, isn't it? Like you say, you know, we don't see babies being admitted in winter to hospital as much as we have done in the past. You know, you said about kind of your baby being ill. I remember having measles as a 5-year-old. I don't remember anything else about being 5, but I remember having measles. It was that horrible. That you know, such a nasty disease, and you know, I'm glad that people don't have to go through that now. So that would be mine, that these diseases aren't, you know, that they're not mild, and they do cause and have caused throughout time a lot of illness and a lot of misery and death in some cases.
Heartache.
Yeah. So just before I wrap up, just to reiterate where people can access the vaccine if they want. So we've mentioned the Knowsley News website, so we're going to keep that up to date with where additional clinics are on. We've mentioned going to your GP. And Gaynor, you've also mentioned the Mersey care clinics as well that are being put on, and how people can access them.
Do you want me to tell them our telephone number?
Yeah.
So you can contact, so the Knowsley Immunisation team contact number is 0151 351 8805.
Well remembered. Okay, any other key messages that we want to take away from anyone today?
Just if I could, one is about terminology.
Yeah.
Terminology around vaccination, I think, is often what puts people off. And if people turn that around to being more about immunisation, I think there'll be a different take on what this is all about. This is not about getting your child or an adult vaccinated. It is about creating that immunity within the community. And I think the word vaccination goes back not too long ago, and I'm not going to take this off on a different subject or a tangent really, but vaccination was a scare tactic, and it was used to scare people in some cases around what was a terrible disease that went across the world. Vaccination from then has kept, I think, a negative connotation, whereas if we talk about immunity, I think it's a better way to describe what we're trying to do for our community, not about vaccination as a singular thing. It's a scary word, you know. I get scared by it. I hate needles, but not everything as a vaccination is a needle.
No.
And I've learned a lot in the past few weeks talking about this subject. So I think, don't see this as just about vaccination. It is about that immunity in our community.
Which rhymes.
I know, I'm impressed.
I think the conversation is important, and I think it's important to just talk about it and know that there is people out there that you can talk to, because I found that there wasn't enough people to talk to, but now that I've reached out a little bit more, there is people there to speak to, and it's important to talk through it.
Yeah. And I think probably people are frightened to even contact us as an IMS service, because they probably feel like our end goal is to
the hard sell.
Vaccinate you with an immunisation.
Exactly.
Sorry, Gary.
No,
I had to use
I
that
understand.
word. But do you know what I mean? And it's not, we want to learn as much as anything. What are the barriers out there? What is stopping you from having your child immunised?
Yeah.
So yeah, no, I mean, it's about people contacting us and having a conversation. I think people might worry about ringing us to have those conversations because they think our end goal is to give you that vaccine to, you know.
They think it's a hard sell, don't they?
And
Or like you'll turn up at the door with the news all ready to go.
We do. We absolutely do in Knowsley. But, you know, there is always that choice there. We absolutely are not going to say to you, you know, you've got to get this immunisation for your child. We just want to give you those positive messages. What are your barriers? What are your concerns? Can we tell you anything different? Can we direct you? And I know you said, you know, you don't particularly like looking at websites, but we use the Oxford Vaccine Group. It's not NHS affiliated. It's an independent website that will, you know, give you the bare bones, give you the facts if that's what you want to work with.
I think also, like you said, it's not a one-time offer either.
No.
If you change your mind, you know, you can still go back.
I think the people in Knowsley know that. We contact, so with our school age programme, if you don't have your HPV in year 8, we will give you that offer again in year 9. How do you feel about it? You know, and we will continually keep that door open unless it's an absolute dissent and they don't want contacting anymore. When you're in year 11, you get a letter to say you're still outstanding some of your vaccinations, and this is how you can access your vaccine.
So lots of opportunities. Okay, thank you for coming tonight. Thanks for your time and your insight. Really valuable, really interesting. And I hope that it's made sense to people out there, and I hope that it's made people think, maybe look a little bit into immunisation if they're still unsure, and I hope that we've tried to alleviate some of those concerns. So thank you, everyone.
Thank you.
Thanks.
Thank you.
Thank you.